Does your skin look like this, or have you seen skin that looks like this? By the time we finish today's video, you'll be able to recognize epidermoid cyst. Sometimes, if it's associated with hair follicles, it's called pilar cyst. You'll also have an appreciation for the different ways to treat these cysts based on their size or thickness. The cyst is defined as a ball of keratin. You can think of keratin as the protein that gives our skin its firm, protective, durable quality. It makes our skin a barrier unless the skin is compromised by skin disease or broken by trauma. It can be counted on as being protecting the underlying structures. The protein keratin, sometimes in and around hair follicles, can grow and extend on the inside, forming all kinds of skin cells, white blood cells, pus, oil, all kinds of keratin and debris trapped on the inside. As you can see in this video, there's a larger version of the cyst. It's pretty prominent, and these kinds of cysts have a thick, substantial wall, and it must be removed surgically with excision. You can also see adjacent to it is a smaller example that can probably be reduced with therapeutic injection. Following the therapeutic injection, as in the smaller one, you can also apply some cream to the surface, hydrocortisone twice a day. You can use tretinoin, vitamin A derivative, watered down and applied twice daily. Also, loratadine is what I include with most inflammatory conditions of the skin. Loratadine, antihistamine twice daily. Also, it's very good to include a one-time dose of prednisone, 5 milligrams, just to jumpstart the anti-inflammatory process. Make sure that is a one-time dose rather than the once-a-week dose that you notice that I will use with an inflammatory skin condition sometimes. Do not use prednisone once a week. In the case of a cystic condition, it can make it get worse, actually. That combination that I mentioned, the hydrocortisone 2.5%, the tretinoin 0.1%, watered down twice daily, loratadine, and the one-time dose of prednisone, that can be used in the case of the smaller one. It can be used to help to reduce the size of cysts for cysts that already exist or cysts that have responded nicely to therapeutic injections. It also can be very helpful in the treatment of conditions that give rise and give origin to cysts, like cystic acne or folliculitis can sometimes lead to cyst formation, but the chances of that happening can be reduced significantly by using the cocktail that I mentioned just before: hydrocortisone, tretinoin, loratadine, and perhaps a one-time dose of prednisone 5 milligrams. I may have mentioned earlier that the larger example of the cyst must be removed surgically. That's very much true. In fact, you cannot hope that that medical combination mentioned, the hydrocortisone, tretinoin, loratadine, prednisone, you cannot use a medical approach to a large cyst with a thick, substantial wall. Instead, that must be removed surgically. It must be removed meticulously to include all parts of the wall, ensuring that all parts of the keratin have been removed. If not, the skin has a higher chance of growing back or recurring. Also, another error that you cannot commit is by draining a cyst of significant size or significantly thick wall. They look nice when you drain a large cyst. This is commonly done in the setting of maybe an urgent care or primary care doctor. They look great. The patient's very happy. But if that keratin and wall is left intact, it is likely to recur. I'm Dr. David Bryant. I'm the proud owner of World's Famous Dermatologist, a dermatology practice in Stockbridge in Decatur, Georgia. We help patients from all races and ethnic groups, but we're probably best known for our expertise in Black skin. The dermatologist that you go to and trust does not need to be a Black American like myself to be qualified to work on Black skin, but whoever you're trusting with these kind of conditions should have experience with a large volume of Black patients and be very experienced with skin conditions that affect darker skin types. I hope you enjoyed today's video. If you did, please like, comment, and subscribe to the channel. Please leave your comments below. I will consider your comments and questions the next time we cover similar content. I look forward to connecting with you on the next video.